Hello and welcome everyone to the Q&A with the experts. Today we are delighted to have with us the head of medical oncology at the Northern Center for Cancer Care at the Freeman Hospital, United Kingdom, Dr. Mark Verrill. We are also pleased to have with us live Dr. Meteb Al Foheidi, who is the Associate Professor and Consultant Oncologist at National Guard Hospital, Jeddah. He's also the President of Saudi Oncology Society. Dr. Mark Verrill and Dr. Meteb Al Foheidi, thank you very much for taking your time out from your busy schedule and record this Q&A with experts. The topic of Q&A with expert is Monarch 2 OS interim analysis data disclosure at ESMO 2019. Question, which is related to the safety of Abemaciclib. And the most important things that you would like for your patients to be educated upon. Dr. Verrill.
When starting any patient on a new medication, it's clearly important to give them information about the treatment, information about the benefits, but also information about the likely side effects. And we do that by going through a process of information giving and written consent. Numerically, the most frequent grade 3 toxicity associated with Abemaciclib is neutropenia. But we know that despite seeing around a quarter of patients develop grade 3 neutropenia, the rate of neutropenic infections is less than 1%. So while it's important that those patients recognise the infections, they're not very likely. There is a reported incidence of grade 3 diarrhoea and more frequently lower grade diarrhoea. In Monarch 2, this was particularly seen in the first few months of the study when the starting dose of 200 milligrams twice daily of Abemaciclib was used, and the frequency reduced when the starting dose was cut to 150 milligrams twice daily. Patients need to know about diarrhoea, even though many of them won't have any diarrhoea at all. If they just get infrequent episodic diarrhoea, it can be easily managed with loperamide. There's a group of patients who get more persistent or more severe diarrhoea who may need dose interruptions while the diarrhoea resolves and then restart at the same dose if the diarrhoea is grade 2, or at a lower dose if it's grade 3 or 4, alongside loperamide, changes to their diet and advice about maintaining adequate hydration. But I'd emphasise that for the majority of patients that we see, diarrhoea is not a major issue, and if it's managed in a detailed way and proactively, it can be overcome in the overwhelming majority of people on Abemaciclib.
Thank you, Dr. Verrill. Dr. Foheidi.
So in regard to the toxicity profile, there were no new signal in regard to the Abemaciclib. We know from the 2017 publication of Monarch 2 that the most common adverse event associated with Abemaciclib was diarrhea. All grade diarrhea was reported in 86%. But grade 3 diarrhea was only reported in 14.5%, and the diarrheal episode occurred during the first 4 weeks of Abemaciclib treatment and was only associated in discontinuation of drug in 1.4%. It has been also observed that the using anti-diarrheal medication with loperamide and dose adjustment resulted in significant management of diarrhea. A very important point for those patients who continue to use Abemaciclib for more than 1 year. All grade of diarrhea was reported only in 28%, which is 3 times less than the initiation with Abemaciclib. In regard to hematological toxicity, Abemaciclib was associated with grade 3 neutropenia, approximately 14.5, and between 10 to 11% with anemia and leukopenia. More importantly, there was no new episode of febrile neutropenia reported in the latest publication. Given this data, I think that Abemaciclib was very well tolerated and the toxicity profile were well managed.
Thank you very much, Dr. Meteb Al Foheidi. Thank you very much, Dr. Mark Verrill, for this digital recording, and stay tuned for more Q&A with experts. Thank you so much, and goodbye for now.